All right, today we're going to tackle a condition that you might be hearing more and more about, but it's still pretty misunderstood. It's called eosinophilic esophagitis. We're going to break down what it is, who the microscopic culprit is, and really get into what this all means for the millions of people living with it.
So let's start with a question that I think some of you might relate to. Have you ever had that split second of pure panic when a bite of food just stops? It feels stuck right there in your chest and it won't go down? For most of us, that's a rare, scary thing. But what if that wasn't rare? What if that was your everyday reality?
Because for millions of people, it's not just a feeling. It's a real, physical symptom of a chronic, hidden war happening inside their own body, specifically inside the walls of their esophagus. And that condition has a name: eosinophilic esophagitis, or just EOE for short.
Okay, so let's get into it. First things first, we have to talk about the symptoms. And this is where it gets tricky, because the signs of EOE are kind of a moving target, which makes it incredibly tough to pin down. You know, one of the most confusing things about EOE is how different it looks depending on how old you are. In little kids, in babies, it might just look like feeding problems, maybe some vomiting. In school-age kids, you might see them chewing their food forever or complaining about pain that seems like heartburn. But then in teens and adults, that's when the classic symptoms really show up: trouble swallowing, what doctors call dysphagia, and that terrifying feeling of food getting physically stuck. This shape-shifting is a huge reason why it can take years to get a proper diagnosis. So, you've got these confusing symptoms, you finally go to the doctor. What's next? Well, now the investigation begins. Doctors have to literally look inside to find direct evidence of this hidden battle. And that investigation is called an endoscopy. A tiny camera goes down the esophagus to scope things out. This image here shows the 5 major signs they're looking for. You can see edema, which is just swelling, these rings that can form, making it look like a trachea, deep furrows or lines, these little white spots called exudate, which are basically clumps of inflammatory cells, and finally, strictures, which are serious narrowings of the esophagus. But here's the twist. Even if a doctor sees all of those things, it's still not definitive proof of EOE. The visual clues, they point to a problem for sure, but they don't identify the actual culprit. To do that, we have to go microscopic. A biopsy is the only way to really solve the case. All right, so now we head to the lab with that tiny piece of tissue. This is where the mystery gets solved. This is where we find the smoking gun that confirms, without a doubt, it's EOE. So meet the main character in our story, the eosinophil. This is a type of white blood cell. It's a soldier in your immune system's army. And normally, it's a good guy. It's supposed to be there, helping to fight off certain infections, like parasites. But in EOE, for reasons we're about to get into, these cells start showing up in a place they have absolutely no business being: the lining of your esophagus. And when they show up, they don't just trickle in, they show up in force. Just look at this slide. On one side, you see what healthy tissue is supposed to look like, all nice and orderly. But on the other side, that's from an EOE patient. It is completely flooded, just infiltrated with all those bright pink cells. Those are the eosinophils. It is a full-scale invasion at the microscopic level. So what's the official confirmation? It all comes down to this number: 15. To get a diagnosis of EOE, a pathologist has to look at that biopsy under a microscope and find 15 or more eosinophils in a single high-powered field of view. 15 is the magic number. It's a diagnostic line in the sand that separates a normal finding from a clear-cut case of EOE. That's the definitive evidence. Okay, so we found our culprit, the eosinophil, but why are they staging this massive invasion of the esophagus in the first place? What's their motive? Well, it all lies in a major overreaction by the immune system. Now, I know this diagram looks incredibly complicated, but the story it tells is actually pretty straightforward. It's all about how the immune system makes a mistake. It all gets kicked off by a trigger, usually an allergen from food that gets through the walls of the esophagus when it shouldn't. Let's just break it down into 3 simple steps. First, an antigen, say a protein from milk or wheat, sneaks past the defenses in the esophageal lining. Second, the body's immune system freaks out and sounds the alarm, releasing these chemical signals called cytokines. You can think of these as emergency flares being shot up into the air. And third, those flares, especially 2 called IL-5 and IL-13, act like a homing beacon, calling in wave after wave of eosinophils to the area. Those cells then arrive and release their toxic contents, causing all that inflammation and damage.
So that brings us to the consequences. What happens if this inflammatory battle just rages on, unchecked, for years and years? Well, the stakes get incredibly high because the esophagus itself starts to change in really dangerous ways.
This image here shows that progression perfectly. On the far left, you've got normal, healthy tissue. Then, the eosinophil invasion leads to chronic inflammation. But over time, that constant inflammation causes something called fibrosis. Basically, the tissue gets scarred and stiff. The flexible muscular tube of the esophagus starts to harden and narrow, and that hardening, that fibrosis, is what directly causes that terrifying feeling of food getting stuck. And that fibrosis has very real, very serious consequences. Get this quote from the clinical guidelines is just staggering. It says that a 20-year delay in treatment after symptoms first start leads to severe narrowing or strictures in 71% of patients. 71%. This is exactly why getting diagnosed early and starting treatment is so critical to stop this process before the damage becomes permanent. But here's the good news. This story does not have to end with permanent damage and dysfunction. Not at all. There is a very effective action plan for managing EOE, for calming down that inflammation, and for getting quality of life back. The treatment strategy for EOE is actually pretty easy to remember. It boils down to the 3 Ds. First up is drugs. This usually means proton pump inhibitors, or PPIs, which can help with acid and inflammation, and also topical steroids that you actually swallow to put the medicine right where the eosinophils are. Second is diet. Elimination diets that remove the most common food triggers, we're talking things like dairy, wheat, eggs, and soy, can be incredibly effective. And the third D is dilation. For patients who already have severe scarring, a procedure can be done during an endoscopy to gently stretch the esophagus, making it wider and making it easier to swallow again. And we'll end on this thought. The number of people with EOE is rising, and it's rising dramatically. It's actually mirroring the increase we see in things like asthma and other allergies, especially in developed countries. And it really makes you wonder, could this hidden battle in our esophagus actually be part of a much bigger story? A story about how our immune systems are reacting to our modern world? That's a question that researchers are working very hard to answer. Thanks for watching.